Suppose you go to the emergency room because you're having chest pain. The doctor there orders a chest x-ray and comes back and tells you the cause of your chest pain is heartburn, and the heartburn is caused by a hiatal hernia. Well, you probably do have a hiatal hernia, and you probably do have heartburn, but they may or may not be related. We'll call this guy George. He'll be my prop. So, your diaphragm is the main muscle that separates your chest from your belly. Your chest, of course, has your lung and your heart, and your belly has all your guts, your stomach, and your small and large bowel, other organs as well. The diaphragm is a muscle that separates this, and which makes it possible for you to breathe. But by contracting your diaphragm, the lungs expand, and by letting it loose, the lungs relax and push out the air. The diaphragm is a solid muscle all the way across, with one exception, has a hole in the middle, and the hole is called a hiatus. So the hole in the diaphragm is called the hiatal, and when something gets pushed through that hole, in this case the stomach, it's called a hiatal hernia. Hiatal hernias are pretty common. Almost everybody has some. That is, there's a little, when you breathe, your stomach, a little bit of your stomach gets pushed up into the chest, and then when you breathe out again, it goes back down. But sometimes it gets really big, and sometimes it gets stuck, and that looks really peculiar on chest x-ray. Now this is a normal chest x-ray. The dip in the diaphragm's middle is distinct. Here's an x-ray showing a small hiatal hernia. Notice how you can see the bulge of the stomach poking through. Now here's one showing a much larger hiatal hernia. Look at the gas at the top. This person will feel much better after they burp. The juncture between the esophagus and the stomach has a valve, and that valve is supposed to stop stomach acid from leaking up through and burning the esophagus. And that's what causes heartburn, when that acid gets up there and burns the esophagus. Sometimes that acid gets all the way up into your mouth and you get that foul, bitter acid taste in your mouth. That's what's happening. You're getting stomach acid going through that valve up your esophagus, and it will cause heartburn. Now we get back to the original case of you going to the emergency room. You may have a hiatal hernia, but the question is, does your hiatal hernia cause a heartburn? And that's questionable. A lot of times people have surgery because they keep having this heartburn, or they have so much stomach in their chest that they can't eat much, or because it's making it hard for them to breathe, and because it's having recurrent heartburn, and the surgeon will open them up from below, pull that stomach back down and sew it up so the stomach doesn't go back up through there. And in some people that works. In some people they no longer have heartburn. But in other people it doesn't work. It's still a problem of an incompetent valve, and the stomach acid will keep going up for the esophagus. So just because you have a hiatal hernia or don't have a hiatal hernia, it may or may not make a difference on whether or not you have heartburn. This is Dr. Philip Levin with a Flash Medical Video. Please subscribe.